Good evening. Buenas tardes, buenas noches. Welcome to our Taking Action for Our Health Fireside Chat, Tomando Acción. I am Dr. Sylvia Preciado, a board member of the National Hispanic Medical Association and an internist working in beautiful Pasadena, California. I have the privilege tonight of serving as your moderator. I welcome our community, nuestra comunidad, to this chat this evening. I welcome also our panelists, three wonderful physicians who practice medicine in this wonderful country, who I will introduce shortly. What is the purpose of this chat? The purpose of this chat is to help us gain a better understanding of how we as a community can prevent diseases through preventive screenings and prevent cancer, heart disease, hypertension, etc. Dr. Paz, how are you this evening?
Hi, Sylvia. I'm doing very well. How are you doing?
I'm doing fine, and your family's well?
Everybody's doing well, and I appreciate
Great.
the invitation to participate in this webinar. I'm
Great.
looking forward to talking to you and my colleagues during this hour.
Well, we welcome you, and tell us a little bit about yourself.
Well, I'm a surgeon by training, but I'm dedicating my life to cancer surgery. I work at City of Hope, which is a cancer center in Los Angeles, similar to other large cancer centers in the country. And we're dedicated primarily to doing research and caring for cancer patients. So that's what I do, cancer surgery.
Thank you. Dr. Gabriela Cora, tell us a little bit about yourself. How are you doing this evening?
I'm doing very well. Thank you, Dr. Preciado. It's a pleasure to be with everybody today and a real honor to have been invited to participate with this great panel.
And Dr. Antonio Perez, tell us a little bit about yourself.
Good evening, everyone. It's a real pleasure for me to be here. I'm Tony Perez. I am a cardiologist. I've been in practice for over 10 years, and I am a medical director with Anthem Blue Cross and Blue Shield. Pleasure to be here.
Thank you. It was wonderful. I've made three wonderful new friends. Well, Dr. Paz is my friend, but new friends.
Yeah, you can't
Thank you for
call
those-
me as an old new friend.
Thank you for those wonderful introductions. So I want you all to just sit back, grab a cup of coffee. If you want your dinner, have a glass of wine, and enjoy our Tomando Acción video. We just have to
Video's
be
not
patient.
playing.
We can't complain. We need to be patient. It'll help decrease our anxiety.
Ariel, if you stop sharing your screen and then share the video, reshare for the video. Ariel, your sound will need to be on and you'll need to restart the video. And then unmute. All right, now. Ariel, if you have headphones on, you have to take them off so that everybody can hear.
The best gift you can give to your family is the gift of good health. Having your preventive health screenings and encouraging family and friends to do the same is one of the best ways of giving this gift. Health screenings are important at every age and will keep you active longer and feeling stronger. We need people to protect their health and that of their loved ones. I worry that my patients, my family, and my community will be ill from diabetes, hypertension, cancer, and other preventable diseases. We need to be role models for our children. What can you do to take action? Visit the website takingactionforourhealth.org and click on Get Started. You'll find information about which screenings will help you care for your health and how to monitor and share your progress. We're living in a really stressful time. Taking care of our community health is really important, especially for our children. This website has a short private screening to tell you if you're at risk for depression and anxiety. It's really easy. There's also a community program called Coffee and Chocolate that can help you and your community cope with stress. This is so important for you and your children. The time has never been more important to have a preventive health screening. Remember, the more education and screenings, the stronger we will be as a community. So as we could hear the theme in the video, education, prevention, action. We have to learn how to take care of our health. Dr. Perez, the COVID pandemic highlighted the many health inequities in underserved populations, especially Latino communities. What are the leading causes of death in Latino communities?
Antonio, you're mute.
You're muted, Antonio.
I'm so sorry. Thank you. The two leading causes of death in the United States in the Latino communities are cancer and heart disease. Fortunately, in 2021, we have in medicine fantastic tools both to diagnose and treat many of the forms of cancer and heart disease that exist. So in healthcare, it's really our job to teach patients across the country that if we can find these conditions early, that can really have a very big impact on their outcome. And if we work on them with patients towards prevention and prevent these diseases in the first place, that's really the ideal aim.
Thank you, thank you. Dr. Paz, as a cancer surgeon working at City of Hope, do you think Latino patients put off their health screenings during COVID? And did it change cancer rates? What do you think?
So as you know, Sylvia, and we've talked many times about this, cancer is the leading cause of death in Latinos. In white, non-Hispanic, the leading cause of death is cardiac disease, but in Latinos is cancer. Now, the incidence of cancer in Latinos is lower overall than Hispanic, but unfortunately, because we don't screen as often, or we have no access because of insurance issues or other issues, we get diagnosed in a later stage. Now, COVID added one more problem, correct? We were afraid to go to any of the hospitals or any of the other facilities to get our screening. Many of the screening centers were closed because of COVID, because of triage, because of the impact of COVID in the nation. And that really threw a monkey wrench to all of us. So not only the Latinos, even the non-Latinos, everybody has been affected by this epidemic. And we are seeing the effect of that. And we probably are going to see a peak in the mortality from cancer in the ensuing years because of the late diagnosis.
Right. Thank you for your comments. And as a primary care doctor, I did see a lot of my patients who did not come in to get their colonoscopies, primarily because of what you just said. The centers were closed. There were patients who were anemic, and then they were later found to have colon cancer. So I think your points are, you made some very good points. Dr. Cora, how did the COVID pandemic, how do you think it affected our mental health, especially in the Latino communities, and how did that affect their overall heart health?
You know, that's such a theme dear to my heart, Dr. Preciado. As a practicing physician and psychiatrist, I've always been very keen on trying to figure out how we can always help people improve their lives and how events really impact our lives. So the pandemic has impacted upon our mental health in very many ways, not only in a very direct way for not having been able to do everything that we regularly did, including working, having outings with our family and friends, going to school in person, and particularly for the Latino community and Hispanics, we tend to really value our community, our face-to-face, our hugs, our kisses, and our being really close physically as well. So that may have impacted upon us in feelings of isolation that may have made things a bit worse. Now, there has been a direct impact of the infection itself in inflammation and in blood clots and some other issues that have affected our central nervous system in other ways. So for example, many people had trouble smelling or with taste, headaches, that brain fog with people having difficulty focusing and concentrating. So you can add everything in terms of that mental health part with that central nervous system health as well as having been impacted by COVID as well.
Thank you so much for those comments. You're right on. Mental health is a big issue we're dealing with our communities as for the whole population in the United States. Dr. Paz, heart disease is the second most leading cause of death among Latinos, as you just mentioned. What contributing factors increase the risk of heart disease in our Latino community?
Well, so it's very interesting that the contributors of heart disease, it also increased the incidence of cancer. So when you look at the causes like obesity, lack of exercise, diabetes, those are also responsible for the increase of cancer death and cancer incidence in all the population. And the biggest epidemic we have among Latinos is obesity. And obesity as a contributing factor of diabetes. And those two phenomena contribute to inflammation, and inflammation contributes to both coronary disease and the incidence of cancer. So when my patients ask me, what vitamin I need to take, or what other supplements or whatever, I said, please don't take any. What you need to do is to live a heart healthy diet and heart healthy life. And that will decrease your incidence of both heart disease and cancer at the same time, which are the two leading causes of death among us.
Right. So what, Dr. Paz, what kind of things do you like to do for exercise?
I play tennis, you know that. You called me the other day. I wanted to talk about the webinar. I said, I'm sorry, Sylvia, I'm playing tennis right now and I'm losing. So I was not a happy camper. I was not about to talk to anybody.
Right, you weren't a happy camper, but the most important take-home message, exercise, move. Just, keep moving. Now, Dr. Cora, what are some of the ways you think we can improve our heart health?
Well, ways in which we can improve our heart health are also consistent with what Dr. Paz mentioned as well, making sure that we move, we're active, we're not sedentary and sitting down all day long, that we walk 2, 3, 5 blocks instead of just going in the car, that we also continue to stimulate our minds with things that are interesting to us as well, that we de-stress, because stress not only affects our mental health, it affects our heart health and cancer as well, that we have good nutrition and access to good food, that we get good sleep, and that we can as well relax so that we can re-energize and continue with our hectic lives. So there's many things that we can do, including good exercise, nutrition, good sleep, de-stressing, and trying to relax.
Thank you very much. Dr. Perez, do you have any comments?
I agree with everything that my colleagues have said. I think one additional point that I would make is part of achieving long-term heart health, that's going to the doctor. And when we go to the doctor, and no matter what type of doctor we go to, we always get our blood pressure measured. And when we go see our primary care doctor, we get our cholesterol checked. If we have certain risk factors, we'll be checked for diabetes. And these are the ways that we can identify these problems as early as possible so that we can make the lifestyle changes with dietary changes in our exercise habit, and if needed, start medication that really have a long-term benefit in helping us living longer, living healthier, feeling well as long as possible. So the other most important thing to do for heart health and to prevent cancer is to go to the doctor.
As a primary care doctor, and I know all of you are not primary care doctors, I will tell you that your primary care doctor can be your advocate, especially if you find a primary care doctor who is very culturally sensitive and understands our community. Dr. Cora, your comment about lack of access is so true. It's easier to go eat at McDonald's than it is to go, it's more expensive to go and buy fresh fruits and vegetables. And the other thing I'd like to just mention is that I don't think any of you mentioned is smoking. Please don't smoke. Our community, because of stress, sometimes they self-medicate with alcohol. We have to stop smoking because, Antonio, would you not agree that smoking is, you're going to have your heart attack?
Absolutely. In fact, one important point is, unfortunately, in the United States, Hispanics that are born in the US have higher rates of death and disease than Hispanics that come to America. And the largest driver of that is related to smoking, unfortunately.
Right.
If I can add something, I will urge everyone on the call today, please go and search for high school pictures of in the early 1900s and compare them to high school pictures on the web of today, we are giants. If you look at the students and you look at the teachers, we are giants compared to them. We are about at least twice the weight and size of people in the early 1900s. And that is not because we have more nutrition, it's we're eating too much pan y tortillas.
An interesting add-on that I like to mention about smoking, which I think becomes quite interesting, when many people start smoking when they're teens, I like to remind people in their 30s or 40s that they may have already been smoking for a good 20 years. And it surprises them to realize that they've been smoking for so long, and what may have been a fun thing to do with their friends when they were teens is now really difficult to continue to do because of how it will affect their health in so very many ways. So really trying to stop smoking will be very, very helpful, as well as trying to exercise more, eat better, and seek. I love how you said it, Dr. Preciado. Hispanics and the Latino community love to chat with their primary care doctor. When you're respected in that regard, you have a lot of power to work together in that collaborative spirit, which will make a huge difference in all this preventive health path. So.
Gabriela, can you comment also on the issue of how early smoking and early alcohol intake in young adults affect to lifetime addiction? Because people don't realize quitting after, if you started in the early age, the addictions are almost impossible to get rid of.
So the younger that people are when they start smoking or using drugs, the higher the chance they have of ending up smoking more, and they definitely smoke more years, or using more drugs. So like you were mentioning before, it's so important to not only be preventive, but also to realize that the faster we try to intervene and make a life change, the sooner we're able to switch that around and seek not only good diagnosis, but also a good intervention, the better off we're going to be over time. So it's just like with cancer, the sooner that we can diagnose, the sooner that we can treat, the best potential outcome. Same thing with heart disease or diabetes or mental health issues. So, that is a big push to really try to be on top of things. Now, I just want to mention something from a psychiatric perspective as well, which is, sometimes people are afraid. They may be experiencing some symptoms, but we have this huge thing called denial, where we're like not even looking at what may be happening, and that may sometimes be preventive. The nice thing about having a wonderful community is that if we have other people who are close to us, they may also realize that something is off. So ideally, I think it's a matter of the community to help one another in trying to help all of us prevent as a family, as a community, and with that public at large. It's not just the person alone, but as a community to try to help each other as well.
Yes, thank you so much for those wonderful comments. Dr. Perez, more than 50% of Latino adults are expected to get type 2 diabetes over their lifetimes. What factors can be attributed to this statistic?
This is an excellent point. Unfortunately, Hispanics are at higher risk over the course of their life at developing type 2 diabetes than other ethnic groups in the United States. And there's a few types of challenges that Hispanics and other groups face that likely contribute to the increase in diagnosis. One is lack of access to care. We were speaking about the importance of a primary care doctor. If someone's family does not have health insurance, if they don't have enough money to access going to the doctor, getting the health checkups, the coaching, the interventions early on that would prevent the onset of diabetes are going to be significantly harder in those patients. The communities in which Latinos live also, especially in urban environments, may not lend themselves to heart-healthy lifestyles that prevent diabetes, because we may be dependent in cars, live in cities with pollution, live in places where there are grocery stores that don't have good access to fruits and vegetables, may not have access to good facilities for exercise. So there's a lot of socioeconomic and psychological stressors, unfortunately, that the Latino community faces that increases our risk for diabetes further.
Right. And a comment that I'll make is that as a primary care, I see a lot of patients with diabetes. And I think we need to educate. I always say educate, educate, educate. And it has to start from working with our doctors, our pediatricians, so that children from the day they're born, we're teaching them about exercise. I don't think I exercised till I was I'd say about 19 years old. And every day I said, oh my gosh, I had the most delicious food. My mother would make me enchiladas. The next day was burritos de carne de puerco. And I didn't know how to eat. And so I think a lot of it is we have to educate our children. We have to start educating the parents so that they could teach their kids and try to make healthier choices for foods at home. I'll give you a story. I always send all of my patients, what do you do if you have a diabetic patient? You say the first thing, diet and lifestyle change. So I send them to the nutritionist at Huntington Hospital, and they come back and they go, Doctora, pero yo no como nada de eso. I don't eat any of the things that were on the list, because they didn't understand the Latino diet. You can't have a Latino patient go and say, make sure you eat this and make sure you eat that. And my patient kept telling them, I don't eat that and I don't eat that. But they failed to understand, to ask them, well, what do you eat? So I think on that point, and back to what Dr. Benjamin was saying, is that finding a primary care doctor, finding people and resources like Tomando Acción, finding resources where you feel like you can trust somebody and you can have a conversation about diet and exercise, that makes a huge impact. And the one thing I will say is that we need to educate more culturally sensitive physicians and healthcare providers, whether it's doctors, physical therapists, occupational therapists. You don't have to be Spanish speaking from East Los Angeles. We need to also educate our doctors to be more sensitive to those communities and understand the culture. So I love the points that Benjamin, Gabriela, Antonio, you're all spot on.
Dr. Preciado, if I may just add one thing, which I think you just alluded to, is there is such a wealthy background that we may have as Latinos and Hispanic, that it's hard to just assume that everybody will eat nachos or that everybody will eat any other kind of food. So I think that you just mentioned that sensitivity, and what I found in working with people of many backgrounds was to just listen to them. What do you eat? So instead of imposing that food or exercise in a way that doesn't match, it's more like asking them, tell me a little bit about what you like to eat. What did your parents or grandparents used to eat? Did you used to eat different things when you were abroad and then you came over here? I think that that's a very important factor in changing diet and lifestyle and many other things that really affect our community in a big way, because you just don't find the same kinds of foods that you would have found back home if you've immigrated to the States. So I loved how you put it, in that context.
So the question again goes to Dr. Cora. Dr. Cora, Approximately 17% of Hispanic adults in the United States reported having depressive symptoms in 2019. What do you think are some of the contributing factors leading to depression in Latinos?
You know, this is the $1 million question, and there's still a lot of stigma around being considered loco or, crazy. No estoy loco. No, I'm not crazy is the first thing that comes to mind. And it is very interesting also how depression, for example, affects Latino men in particular, because to be depressed as a man may be a sign of weakness. So there's going to be that denial in terms of, I'm okay, I'm just fatigued, tired, stressed out, burnt out, you name it. So many other words are being used instead of, not using the other one. So interestingly, there's a lot of underdiagnosis and undertreatment because of this stigma and because of the denial and, because of lack of access sometimes, or because they do go to a healthcare practitioner, but the healthcare practitioner is not culturally sensitive or culturally competent or proficient, and then the person shies away and they don't say anything. The other thing that is also important in our healthcare system these days is that oftentimes many practicing physicians, including primary care and specialists, including psychiatrists, is you really need to be ready to open the Pandora's box if you ask the person how they're feeling. Because if someone is really depressed, they're not going to tell you, I'm feeling depressed in a minute, and then off you go to see the next person. So there's that sensitivity to be able to provide time, support, in a way in which the person may feel more comfortable opening up about how they're feeling as well. So that is another factor. So many Latino men tend to suffer by themselves. Latinas tend to communicate with one another a bit more. We tend to be more verbal with one another. So sometimes that provides a bit more of that support in that community aspect as well.
Yes. Antonio Benjamin, would you like to respond?
Let Antonio respond first.
I think those are all excellent comments. Unfortunately, it's the struggle that we have as Latino men, where we may be taught when we're young that we're supposed to be tough and handle life's challenges on our own. But really, it's our job as healthcare professionals to teach patients and each other that when we're struggling, we're a community. And when we open up to people who care about us, our physicians, our nurses, our other family members, we can realize where we may not understand where we're falling short, and then also access the perspective of others, and most importantly, the treatments that can help us get better. So I think one very strong message to all Latino families here is that if they're struggling with a lot of psychological stress, if they think they may be depressed or anxious, the next best thing to do is to talk to your doctor about it, talk to a friend and a family member about it, be open about it. It's really something that many people experience over the course of their lives, and it's not something to have any shame about. And like many of the diseases we're talking about, these are conditions that have very good treatments. So we should really be offering patients a tremendous amount of hope when they bring these challenges up.
If I may add, there's several studies showing that men live longer if they're married, and women live longer if they're single. And the fact is that to the women on the line, you are the health deciders and advocates for your family. Never let your husband, never let me or Antonio go alone to the doctor. We don't listen. We actually won't tell you what the doctor tells us. Everything is fine. That's usually my answer to my wife. So don't let us go alone. You are the advocate. Make sure that we go to the physicians, make sure we follow on the advice, and make sure that we do the cancer screening appropriate to our age. We are awful. Women really, Hispanic women are very good at cancer screening. Actually, the cancer screening rates among women, for example, mammography in the United States for Hispanic women and non-Hispanic women is almost the same. It's slightly less. But for men, like prostate cancer screening or colorectal cancer screening is awful, very low at the 50th percentile compared to other ethnic groups. So don't let your husband go alone to the doctor. That's the best thing you can do.
I agree. I actually agree with that. And I just want to share with all of you who are on, as a primary care doctor, the majority of men in my practice were brought in by their wives. Their wives bring them in by the ear and say, make sure that you're getting your screenings done. Is that not true, Benjamin?
Yes.
We take care of our families. And it's so important because, we talk about preventive screenings. And what I want you all to know is all you have to do is ask. When you come to a primary care doctor, we will let you know, depending on your age, what kind of tests you need. We got to screen you for diabetes. We've got to make sure you're not anemic. We got to make sure if you're over 50, you've had a colonoscopy and you're screened for colon cancer. In women, young women, we have to explain to them that there's a risk of getting a human papillomavirus that later on can lead to cervical cancer. So that's the role of the primary care doctor. And then when we see that there might be a problem, which unfortunately in my community, we see so much diabetes that we send a lot of the patients to Antonio Perez, so he's taking care of their heart. And then when they're dealing with depression, we send them to Gabriela. One thing I will say, and this is just something that I've never actually been happy with medicine. I love practicing internal medicine, but during a busy day, even as physicians, we're taught to take the blood pressure, listen to heart, get some labs, do appropriate screening tests, but we always run out of time to take care of one's mental health or ask them about their family. There's reasons why we have family history. There's reasons why we ask patients if they smoke, if they have stress, what kind of job they do. It's not just because we want to be nosy about, oh, are you a physical therapist? Are you a doctor? No. What do you do? I had patients during the pandemic who were cooks, they were housekeepers, and they worked in nursing homes, and they could not take a day off because they needed to take care of their families. And as a result of that, their mental health suffered.
So Dr. Preciado, if I may add to that, which is it's very important what you just mentioned. We can have easy ways of looking at whether someone has diabetes or someone has hypertension or someone has a lump. But oftentimes people who are depressed or anxious look the same on the outside, unless it's very obvious that, their gaze is down, they're slow when they walk, or they have trouble making their decisions. So unless we ask, unless we have that curiosity about the other person, unless we're open about listening to them, we can miss many other things as well. So that's where that preventive, and that's how it's so important for people to trust their practitioners so that they can have this strong bond in which, someone like you, Dr. Preciado, who knows their patients, you're going to realize if your patient may be saying everything's fine, but it's not fine because you've seen this person with a lot of energy or with a lot of being alive before, and then all of a sudden it's like their whole posture changes. So that's why this is such an important point. It may not be so obvious to people that someone is depressed or anxious or suffering on the inside.
Exactly. Antonio, do you have any comments?
Well, I think building off Dr. Paz's points, I think this is a good time to challenge men to really learn from the women in their lives and be advocates for themselves and for the other family members that they have who may not be able to advocate for themselves at all periods of time. It really should just not fall on the women in our families to do that type of work. On the point particular about depression, I think within families, if we see changes in family members that we think may be suffering from depression or anxiety, a great thing to do is to ask them about it and encourage them to talk to their doctor about it when they go to a visit.
Right.
I was looking at, sorry, go ahead. No, I was just looking at the participants. I was looking at the
Yes.
participants' names, and I see among all the participants, I think there's only 3 males on the participants. So
Maybe we should
it
start
really
with
is.
getting on the webinars.
Right. I'll share with you that one thing I've always said to a lot of the health plans is that you have to remember the relationship is between the primary and the patient. If you get that relationship and you improve that relationship with your patient, you're going to have better outcomes. And when we talk about depression and anxiety, by the time you have your 15-minute visit, it's over. You don't have time to get to that point. And so what I always say to my colleagues who work in big groups is that how can you possibly give adequate care to 30 patients in a day? So we have to figure out a system in this country where we're allowed as primary care doctors to take ownership of those patients and really take them from day one to the end of their life. Because the beautiful thing for me, and it's fun speaking to a cardiologist and a psychiatrist and a cancer surgeon, is that I have the beauty of being able to take a patient from their first visit and take them all the way to the end of their life. I see them in the office, I see them in the hospital, I see them in the nursing home, and then I deal with end of life care. And that's the beauty. And I want to remind everybody on the call that guidelines are guidelines. I had a patient yesterday tell me, no, they said that you don't have to have a pap smear every year. I said, but you need one every year because you've had cancer. And the other lady, another nice patient the other day had a breast lump, and I felt the lump. You must tell me, right, Benjamin? You must know, what is that lump? You don't say the mammogram was fine, the ultrasound fine, go along your merry way. You must know what it is. So I always try to work with the health plans and tell them, guidelines are guidelines. That's what they are. Guidelines are guidelines. If your dad had a heart attack at age 50, you could be 48 years old. And I will say, your insurance probably isn't going to cover this, but you're going to see Antonio Perez, because I can guarantee you that something might go wrong with that patient's heart. So that's just your moderator, your primary, letting you know a little bit about primary care.
I think you touch upon something very important: the difference between screening and diagnosis. Okay, so if screening is for somebody that is completely healthy, that has no pre-existing factors of risk factors, that's a screening. So women without, 40-year-old women without any personal risk factors, and goes for a screening mammogram that is appropriate. Once you have a symptom, pain, a lump, chest pain in the case of Antonio, or any depressive symptom, you're not having screening tests anymore. You're having diagnostic tests. And I think because now we are working on ruling out the potential existence of a disease, we're not screening anymore. We're making a diagnosis. And that's a huge difference on the test you order and how you follow through after those tests.
Thank you. Dr. Cora, did you know that smokers are more likely to have depression than non-smokers? What are some reasons behind this?
You know, it is really interesting that many people with mental health issues in general tend to smoke more. So we find this not only with depression, but with some others as well. Sometimes smokers feel like they feel a little bit more relaxed, for example, when they smoke. But by the end of the day, you know, the cycle continues. So it's not like that will save or cure their depression at all. And that is why it is important for us to figure out if there are any patterns of smoking or any other drug use as well. So sometimes it's very important for practitioners to inquire not just about smoking cigarettes, but other drug use as well, because it may not surprise some people when people start using other kinds of drugs or products that will make them feel different. So for example, many people, including physicians and practitioners, drink a lot of coffee maybe during the day to feel a little bit more energized. Drinking coffee may not be so unusual for us, and it's usually well, you know, accepted by most people. But if we're drinking 10 cups a day, then that may be another issue, or same thing with caffeinated drinks. Same thing with alcohol, for example. Some people drink a glass of alcohol to sleep at night. And maybe a glass may not be a big thing, but if that, you know, it increases into 2, 3 more or more, then it may become a problem. So it is interesting to look into smoking and use of other drugs or substances in general.
Antonio, would you like to comment on that question?
Absolutely. I think for us who see patients who have diseases like heart disease or cancer and have a long history of smoking, we often find that for many of those patients, the smoking has provided something for them, a comfort in their life over the course of their life, maybe as a consequence of some other stressors that they experience, certainly very relevant to the Latino community. And part of our job in treating their condition and preventing their condition from getting worse is helping them unpack the stressors and maybe the mental illness like depression or anxiety that's keeping them from being able to overcome their smoking. It goes back to what you were saying earlier about the importance of having a close relationship with your patient, so that if you think that they may be dealing with things like depression or anxiety, and that may be interfering with their treatment or worsening their other diseases like heart disease or diabetes, we really have to be comfortable as healthcare practitioners, both primary care doctors or subspecialists, in bringing this up to patients and being clear that we're really there to listen to them and think of them as a whole person when we're focusing on combating or preventing a certain type of specific diseases.
I completely agree with you, Antonio. Some of my patients, especially my Spanish-speaking patients, will come in, and one of the ways that I convince them to take their medication or to adhere to their treatment plan, they might say, "Pero doctora, you know, I like to have my tecito in the morning." And I'll always say, you don't say, no, that's bad for you. What I usually do, I go, "Tómese su hierba buena," and then take your medication and do this. And usually I'll get them to help me out as a physician to do that. And I just wanted to say that you all were just such wonderful people to work with this evening. And Benjamin, Gabriela, and Antonio, just like all of you who have logged on and allowed us to come into your homes and your offices, they're patients too. And I think what, if I may say, that I think one thing that sort of differentiates Latino doctors from others is that I think we bring that passion to that office visit. We bring the love that we have for our community, and we actually really care. And if you listen to the video, I mean it when I say that the best gift you can give your community, and your family, it's the gift of good health. Because we love to have our parties. We love our salsa dancing. We love our tennis. We love having a lot of fun, and we're very family oriented, but we have to just improve the health. We have to improve access for healthcare for all our Latino community. And that's why these websites are very important, because nowadays you could look up on a website, you could look up on Tomando Acción, and you can learn about how you can take care of yourself. So what I'd like to ask Benjamin, do you have any closing remarks for our audience, and what would be one take-home message you would give them?
So I think the most important thing to do in cancer prevention and heart disease is deal with obesity. And what I always tell my patients is the first step in losing weight is to stop gaining weight. Don't try to lose weight immediately. Adopt some healthy habits. And I tell them, just stop snacking. Eliminate all the snacks in between meals. That's simple. I will do it. And stop gaining weight. We must stop obesity. Obesity is a central problem of the medical problems we face today as Latino. Please spend some time looking at our pictures on websites, gatherings, and so forth. You will realize how big we've become. Please stop gaining weight.
Dr. Gabriela, Cora, it was very nice meeting you this evening. What do you have a message that you'd like to give the audience this evening?
Sure. First of all, find a practitioner with whom you can connect and who you feel understands who you are. The next step is think about your cycle. Wake up in the day, get good, a good meal, good nutrition so that you can start with a lot of energy. Move during the day, take breaks, take power breaks, relax if you are very stressed and if you have a ton of things to do. And then imagine how well that will allow you to sleep better at night. And all this cycle over and over again will hopefully help you keep your mental health, keep your weight in check, and really be as healthy as you can so that you can spend as much time as you want with family and friends and your community.
Antonio, I never want to be in your office and see you if I have a heart attack. I want to prevent that heart attack. What's your take-home message to the community?
My main message is really one of tremendous hope. If patients can go to the doctor, get screenings for diseases like hypertension, diabetes, high cholesterol, cancer, that will either help us prevent or really identify early on many diseases that cause a lot of suffering for the Latino community. But even when those diseases are present, we're so fortunate to live in a time and in a country where we have so many great treatments for those ailments. So there's no reason why anyone who has access to going to see the doctor shouldn't, because of fear that they're not going to be helped or that their particular issues are not going to be understood. We're really here as all healthcare practitioners for you and to help you as best we can with empathy and hope.
Thank you so much. As a board member of the National Hispanic Health Foundation, I would like to just say, please, everyone, get your vaccine. Very important. If you have any concerns, contact your primary care doctor. I think all of us, Benjamin, Gabriela, Antonio, we are there to help you, the community, educate our community. We're there to help you take care of your health. We're here to help you get your the preventive screenings that you need. And we're here to be your advocates. And one thing I'd like to thank Dr. Elena Rios, because I actually know her from 20 something years ago. I think this organization is what we also are doing is we're trying to educate. We are trying to find and seek and educate the next Latino physicians, physical therapists, and health care professionals, because when you are with someone who understands you, you are going to do better at taking care of your health. So I would like to thank everyone who helped us get this online. And a glitch is a glitch. It doesn't matter. In the end, you all received, I hope, wonderful information. Benjamin, thank you. Gabriela, thank you so much. You're so charming. And Antonio, thank you so much for all the wonderful
Muchas
work.
gracias, Silvia.
Have a
Yes.
great evening, everyone. Go have some dinner now.
And a drink.
Take care.
Have a drink. I'm drinking my water.
And then take a walk
I'm
after
good.
dinner.
Yes.